Dr. Elena Martinez stood in the main medical bay of the USS Liberty, checking her equipment one last time. Today would be different from any other day in her 20 years as a combat medic. 3 alien doctors were coming to watch how humans treated battlefield injuries. The Galactic Medical Council had set up this exchange program to share knowledge between species. Elena looked out the window at the red surface of Kepler 442b. This planet had become a training ground for human soldiers. Real combat situations happened here, but today it would be a controlled exercise. Still, the injuries would be real, and the medical work would be just as urgent as any battlefield. The transport ship landed with a soft thud outside. Elena watched as 3 very different alien beings walked down the ramp. Captain Jake Morrison met them at the entrance and brought them to the medical bay. The first alien was Dr. Zethkari from the Luminari people. He was tall and thin, almost like he was made of light itself. His skin glowed with a soft blue color, and he moved like he was floating. Elena had read that his people had changed their bodies through science, so they never felt pain. The second visitor was Dr. Vosichin from the Helix Collective. His body looked like it was made of living crystal, clear and sharp. When he moved, small lights danced inside his crystalline form. His people could fix their bodies by eating certain minerals, like how plants grow. The third alien was Dr. Nithara from the Aquatic Federation. She had many tentacles instead of arms and legs, and her skin was smooth and wet-looking. Patterns of light moved across her body when she communicated. Her people healed using special energy that came from their bodies. Elena stepped forward and extended her hand. "Welcome to the USS Liberty. I am Dr. Elena Martinez, Chief Medical Officer." Dr. Zethkari's glowing form flickered as he tried to understand the gesture. "Greetings, Dr. Martinez. We are here to observe your healing methods. We have studied human anatomy, but we have never seen your medical practices in action." Dr. Vosichin's crystal body made a soft chiming sound as he spoke. "Our species are curious about human medicine. We understand you use primitive tools and methods, yet your survival rates are surprisingly high." Elena smiled, but felt a little insulted by the word primitive. "Our methods might seem basic to you, but they work very well. We have been fixing battlefield injuries for thousands of years. Dr. Nithara's tentacles moved in complex patterns. We have reviewed your medical files. Humans seem to recover from injuries that would kill most other species. This seems impossible to us." Captain Morrison joined the group. "Doctors, let me explain today's exercise. Our soldiers will run through urban combat training on the surface. The injuries they get will be real, though we try to keep them from being too serious. Dr. Martinez and her team will treat any casualties that come in." The captain was a big man with gray hair and steady eyes. He had been a soldier before becoming a ship captain, and Elena knew he understood battlefield medicine well. "The aliens will watch from the medical bay. They can ask questions, but please don't get in the way of treatment." Elena nodded. "Our people are used to working under pressure. When injured soldiers come in, we work fast and don't have time for long explanations." Dr. Zethkari's glow dimmed slightly. "We understand. We are here to learn." Sergeant Lisa Parker entered the medical bay wearing full combat gear. She was the leader of the soldiers who would be training today. She was tough and experienced, with short brown hair and sharp green eyes. "Doc, my people are ready to start the exercise. We will be running combat scenarios in the old city ruins about 5 miles from here. If anyone gets hurt, we will bring them back here fast." Elena checked her medical supplies one more time. "We are ready on this end. Try not to get too beat up out there." Lisa grinned. "No promises, Doc. You know how these things go." The alien. Doctors watched this exchange with interest. Dr. Vosichin made more chiming sounds. "Your soldiers seem unconcerned about potential injury. Do they not fear pain?" Elena laughed. "They fear it, but they do not let that fear stop them from doing their job. Humans have learned to work through pain and injury. It is part of who we are." Dr. Nithara's light pattern shifted rapidly. "This is most unusual. Most species avoid situations that might cause harm." "Not humans," Elena said. We run toward danger when duty calls. Our soldiers know they might get hurt, but they also know we will patch them up and get them back in action. The exercise began an hour later. Elena and her team prepared the medical bay for casualties. She had worked with Nurse Katie Williams and Medic Bob Chen for 3 years. They knew each other's movements and could work together without words. The alien doctors positioned themselves where they could see everything but stay out of the way. Elena noticed they kept looking at the basic medical tools: scalpels, bandages, sutures, and IV tubes. To them, these must have looked like ancient artifacts. Dr. Martinez, Dr. Zethkari asked, "Where are your regeneration chambers and molecular repair devices?" Elena looked confused. "We do not have anything like that. We use surgery, medicine, and time to heal injuries." The alien doctors looked at each other with what Elena thought might be concern. Dr. Vosichen's crystal body flickered rapidly. "How? Do you repair damaged tissue without energy manipulation?" "With our hands, skill, and experience," Elena replied. "Human doctors have been fixing people this way for centuries. We get very good at it." Over the radio they heard the first sounds of the training exercise beginning. Explosions echoed across the planet's surface, and the sharp crack of weapons fire filled the air. Elena felt her pulse quicken. Soon the first casualties would arrive. The alien doctors moved closer to the windows, trying to see the exercise in the distance. Dr. Nathara's tentacles writhed nervously. "The violence seems very realistic." "It has to be," Elena explained. "If we want our soldiers to be ready for real combat, the training must be as close to the real thing as possible." Elena activated the communication system. "All medical personnel prepare for incoming casualties. This is not a drill." The alien doctors stared at her. "Not a drill," Dr. Zethkari repeated slowly. "You mean the injuries will be real?" "Yes," Elena said, pulling on her surgical gloves. "In a few minutes, you will see exactly how humans deal with battlefield trauma. I hope you are ready for this." The first explosion was bigger than expected. Elena heard it through the thick walls of the medical bay, and she knew someone was hurt. The radio crackled to life with urgent voices calling for medical support. "Medical team, we have casualties. Coming in. 2 soldiers down, 1 serious," came the voice of Sergeant Parker from the field. Elena moved quickly to prepare. "Katie, get the trauma bay ready. Bob, check our blood supply and start warming some units. We are about to get busy." The alien doctors moved closer, their different forms of communication showing clear anxiety. Dr. Zethkari's glow became brighter and more rapid. Dr. Vosichen's crystal body made sharp, high-pitched sounds. Dr. Nathara's tentacles twisted together in complex knots. The medical bay doors burst open. 2 soldiers carried Private Danny Collins between them. Blood covered his uniform, and Elena could see immediately that shrapnel had torn through his stomach area. Collins was conscious but pale, his breathing fast and shallow. "What happened?" Elena asked while moving toward the injured soldier. "Explosive device went off too close," one of the soldiers said. "Collins took most of the blast fragments in his gut." Elena and her team moved Collins to the trauma table. "Danny, can you hear me? You are going to be okay. We are going to take good care of you." Collins managed a weak smile. "Hey, Doc. Looks like I got myself into some trouble." The alien doctors watched in shock as Elena began cutting away Collins' blood-soaked uniform. They could see the extent of his injuries. Several large pieces of metal had penetrated his abdomen, and he was losing blood quickly. Dr. Zethkari stepped forward, his glow now pulsing rapidly. "Dr. Martinez, where is your emergency stasis field? The patient needs immediate molecular stabilization." Elena looked up briefly while examining Collins' wounds. "We do not have stasis fields. We use direct surgical intervention." She turned to her team. "Katie, start 2 large-bore IVs. Bob, get me 4 units of O-negative blood and prepare for emergency surgery." The alien doctors looked at each other with what could only be described as panic. Dr. Vosichen's crystalline form began vibrating. "You cannot perform surgery without bioenergetic support systems. The trauma will cause system failure." Elena was already working. her hands moving quickly and surely. "Collins, I need you to stay awake and talk to me. Tell me about your family." Collins grimaced but managed to speak. "Got a wife back home, Doc. Susan. And a little boy named Pete. He just turned 5. "Good," Elena said, probing one of the wounds carefully. "You are going to see them again soon. This injury looks worse than it is." Dr. Nithara's tentacles writhed frantically. "The patient remains conscious during severe trauma. How is this possible? Most species would have entered shock by now." Elena continued her examination while explaining. "Humans are tough. We evolved to survive injuries that would kill other animals. Collins here has lost some blood, but his vital signs are stable. Bob returned with blood bags and IV equipment. Doc, his blood pressure is dropping, but his pulse is strong. Start the transfusion," Elena ordered, "and get Dr. Walsh from the surgery prep room. We need to operate now." Dr. Kevin Walsh arrived quickly, already in surgical scrubs. He was a skilled trauma surgeon who had worked battlefield medicine for 15 years. "What do we have, Elena?" "Penetrating abdominal trauma, multiple fragments, possible organ damage. He is stable enough for surgery." The two human doctors worked together to move Collins to the surgical suite. The alien doctors followed, staying out of the way but watching everything with growing amazement. "Collins, we are going to put you under anesthesia now," Dr. Walsh explained. "When you wake up, you will be fixed up and ready to go home to Susan and Pete." "Thanks, Doc," Collins said, before the anesthesia took effect. The aliens watched as the human medical team began surgery using what they considered primitive metal instruments. Elena made careful incisions while Dr. Walsh controlled bleeding and removed shrapnel fragments. "Incredible," Dr. Zethkari whispered. "They repair tissue damage using manual manipulation and metal tools." Dr. Vosichin's body was now vibrating so rapidly that he was making a continuous humming sound. "The precision is remarkable, but how do they prevent cellular degradation without energy fields?" Elena looked up from the surgery. "We use our knowledge of anatomy, our experience and careful technique. Human tissue heals very well when properly treated." During the surgery, another casualty arrived. Staff Sergeant Tony Rodriguez had been caught in a secondary explosion and suffered a compound fracture of his right leg. The bone was sticking out through his skin, and he was in obvious pain. Nurse Williams immediately began treating Rodriguez, while the doctors continued with Collins. "Sergeant, I am going to give you something for the pain and start an IV." Rodriguez gritted his teeth. "Just fix me up, Katie, I have got work to do." The alien doctors stared at Rodriguez in disbelief. Dr. Nithara's light patterns flashed rapidly across her skin. "Another patient who remains functional despite severe injury. This defies all biological logic." Rodriguez looked at the aliens with curiosity. "You folks never seen a broken bone before. This is nothing. Had worse injuries playing football in high school." Dr. Vosichin made a sound like breaking glass. "Playing for recreation. You injure yourselves intentionally." "Sure," Rodriguez said with a pained grin. "How else do you get tough?" Elena finished removing the last piece of shrapnel from Collins' abdomen. "Okay, that is all of it. Kevin, check for any bleeding I might have missed." Dr. Walsh examined the surgical site carefully. "Looks good. His liver had a small tear, but it is already starting to heal. Humans have amazing regenerative capabilities." The alien doctors moved closer to see the surgical site. Dr. Zethkari's glow dimmed with shock. "The organ tissue is already beginning to repair itself. How long will full healing take?" "Collins will be back to light duty in about 6 weeks," Elena said while beginning to close the incision. "Full combat duty in maybe 3 months. "Impossible," Dr. Vosichin said, his crystal form flickering rapidly. "Such extensive trauma should require at least 2 cycles of regeneration therapy." Elena smiled while suturing. "Humans do not need regeneration therapy. We just need good medical care and time to heal. Collins has both." As Elena finished the surgery, Bob was preparing Rodriguez for treatment of his compound fracture. "Doc, Rodriguez needs surgery to repair this leg fracture." Elena looked at Rodriguez, who was alert and talking despite his injury. "Tony, how are you feeling?" "Been better, Doc. but I have been worse too. Just get this bone back where it belongs." Dr. Nithara's tentacles had stopped moving entirely. She stared at Rodriguez in complete confusion. The patient jokes while suffering severe skeletal trauma. This is not possible. "Welcome to human medicine," Elena said, preparing for her second surgery of the day. "Our patients do not give up, so neither do we." The alien doctors watched as Elena and Dr. Walsh began the complex process of repairing Rodriguez's compound fracture. They used metal rods and screws to hold the bone in place while it healed naturally. "In 6 months, Rodriguez will be running and jumping like this never happened," Elena explained while working. Dr. Zethkari's glow began to flicker erratically. "Your species appears to be indestructible," Elena laughed. "Not indestructible, just very good at bouncing back from damage." The third casualty came in screaming. Corporal Amy Stewart had been caught in an incendiary blast and severe burns covered 30% of her body. The smell of burned flesh filled the medical bay as the soldiers carried her in. Elena took one look and knew this would be the hardest case of the day. Burns this severe were always difficult to treat, and they required immediate action to save the patient's life. "Get her to Trauma Bay 2, Elena ordered. "Katie, start fluid resuscitation. Immediately. Bob, prepare the burn treatment supplies." The alien doctors followed the medical team, and Elena could see shock in their alien features. Dr. Zethkari's glow had become very dim, and he moved slowly as if his energy was failing. Stewart was conscious but in terrible pain. Her face was twisted with agony, but she was fighting to stay alert. "Doc, how bad is it?" she managed to ask through gritted teeth. Elena examined the burns quickly. They covered Stewart's arms, chest, and part of her face. Second- and third-degree burns that would require months of treatment and multiple surgeries. "Amy, you have been burned pretty badly, but you are going to make it. We are going to give you medicine for the pain and start treating these burns right away." Dr. Vosichin moved closer, his crystal body making rapid chiming sounds. "Dr. Martinez, burns of this severity are typically fatal. Do you have advanced cellular reconstruction equipment?" Elena was already working to clean and treat the burned areas. "No cellular reconstruction. We use traditional burn treatment methods: fluid replacement, pain management, wound care, and skin grafting." "Skin grafting?" Dr. Nithara asked, her tentacles barely moving. "We take healthy skin from other parts of Amy's body and use it to cover the burned areas," Elena explained while working. "The human body can grow new skin to replace what was damaged." The alien doctors looked at each other with expressions of complete bewilderment. Dr. Zethkari spoke in a voice that was much quieter than before. "You remove tissue from healthy areas to repair damaged areas. This seems like causing additional trauma." Elena continued her work, carefully cleaning the burn wounds. "It works very well. In a few months, Amy will have new skin covering all these burned areas. She will have some scars, but she will be fully functional." Stewart managed a weak smile despite her pain. "Doc, will I still be pretty enough for my boyfriend?" "You will be beautiful, Amy. Scars are just proof that you survived something that tried to kill you." Dr. Walsh arrived to help with the burn treatment. Together, the two doctors worked for hours, carefully removing damaged tissue and preparing the wounds for eventual skin grafting. The alien doctors watched this process with growing distress. Dr. Vosichin's crystal form was now flickering rapidly, and strange harmonics came from his body as he tried to process what he was seeing. "The patient remains conscious and interactive during extensive tissue damage repair," he observed. "My species would require full sensory shutdown for such procedures." Elena looked up from her work. "Amy is tough. All humans are tough. We have to be." As Elena worked on Stewart, Collins was waking up from his surgery in the recovery area. The alien doctors could see him through the open door, sitting up in bed and talking to one of the nurses. Dr. Zethkari pointed toward Collins with a trembling finger. "The patient from the first surgery is already mobile. How long has it been since his operation?" "About 4 hours," Elena replied while continuing to treat Stewart's burns. 4 hours, Dr. Nithara repeated, her tentacles writhing. "Our species require days of regeneration support after such trauma." Collins called out from his bed. Hey doc, when can I get back to my unit? The guys will be wondering where I am. Elena shook her head with a smile. Danny, you just had major abdominal surgery. You need to rest for at least a few days. But I feel fine, Collins protested. Just a little sore. Dr. Zethakari's glow suddenly became very bright, then very dim. He feels fine. Major surgical, trauma, and he feels fine. In the next bed, Rodriguez was also awake and alert despite his compound fracture surgery. His leg was in a cast, but he was sitting up and eating a meal. Rodriguez, how is the pain? Elena asked. Not too bad, Doc. The pain medication is working good. When can I start physical therapy? Elena checked his chart. We will start gentle movement exercises tomorrow. Full physical therapy in about 2 weeks. Dr. Vosichin made a sound like shattering crystal. 2 weeks. Recovery from skeletal reconstruction should take months. Not for humans, Elena explained. We heal fast when we are properly motivated. Rodriguez nodded. Gotta get back to my squad, Doc. They need me. The alien doctors were now showing clear signs of psychological distress. Dr. Zethkari was leaning against the wall, his glow very faint. Dr. Vosichin's crystal body was making continuous high-pitched sounds. Dr. Nithara's tentacles had formed tight knots that she could not seem to untangle. Elena finished the initial treatment of Stuart's burns. Amy, we are going to move you to the burn unit now. You will need several surgeries over the next few months, but you are going to recover completely. Stuart managed to give Elena a thumbs up with her unburned hand. Thanks, Doc. I knew you would take care of me. As the medical team moved Stuart to the specialized burn treatment area, Elena noticed that the alien doctors were acting very strangely. Dr. Zethkari was barely glowing at all, and he seemed to have trouble standing upright. Dr. Zethkari, are you feeling well? Elena asked. The alien physician looked at her with what appeared to be exhaustion. I do not understand what I am seeing. Your patients suffer trauma that should be impossible to survive, yet they remain alert and optimistic. They recover from injuries that would permanently disable my people. Dr. Vosichin's crystal form was now making almost no sound at all. Your methods appear primitive, yet your results exceed anything we have seen in galactic medicine. Elena felt a moment of pride in her profession and her species. Human medicine has developed over thousands of years of treating injuries and illnesses. We have learned to work with the human body's natural ability to heal itself. Dr. Nithara finally managed to untangle some of her tentacles. Natural ability to heal. Most species require technological assistance for major trauma recovery. Humans are different, Elena said. We have always had to be tough to survive. Our bodies and our minds are designed to keep going even when damaged. Collins called out from his recovery bed again. Doc, can I at least call my wife? She will be worried if she does not hear from me. Elena smiled. Of course, Danny. Tell Susan you are fine and will be home soon. Dr. Zethkari stared at Collins making his phone call. He suffered life-threatening abdominal trauma less than 6 hours ago. Now he is concerned about reassuring his family that he is well. That is what humans do, Elena explained. We take care of each other. Collins is not thinking about his own pain. He is thinking about his wife's worry. The alien doctors looked at each other, and Elena could see that they were struggling to understand not just human medicine, but human nature itself. Dr. Vosichin's crystal body flickered weakly. We came here to study your medical techniques. Instead, we are learning about something far more complex. Elena nodded. Human medicine is not just about fixing bodies. It is about understanding the human spirit. By the next morning, the alien doctors were in serious trouble. Dr. Zethkari had stopped glowing completely and was having difficulty standing. Dr. Vosichin's crystal body was making strange grinding sounds instead of his usual musical tones. Dr. Nithara's tentacles had knotted themselves so tightly that she could barely move. Elena found them in the observation area, where they had spent the night watching the human patients recover. Collins was out of bed doing light exercises. Rodriguez was already working with a physical therapist. Stuart was alert and asking about when she could start her skin graft surgeries. Doctors, you do not look well, Elena said with concern. Doctor, Zethkari turned toward her, his usually bright features now completely dark. Dr. Martinez, we are experiencing what our species might call psychological system failure. What we have witnessed defies everything we understand about biology and medicine. Elena sat down beside the struggling alien physicians. What exactly is troubling you? Dr. Vosichin's crystal form flickered weakly. Your patient Collins should be in critical condition for days after his surgery. Instead, he is exercising and planning his return to duty. This violates all medical probability. Elena looked through the observation window at Collins, who was doing stretching exercises while talking to his wife on a video call. Danny is healing normally for a human. His body is repairing the surgical damage and his mind is focused on getting better. But the trauma, Dr. Nithara managed to say through her tightly wound tentacles. The physical damage, the pain, the disruption to his biological systems. How does he function? Elena thought for a moment about how to explain this to beings whose experience was so different from human experience. Humans have learned to separate immediate survival needs from long-term healing. Collins knows he is injured, but he also knows he will recover. So he acts like someone who is recovering, not like someone who is dying. Dr. Zethkari's voice was barely audible. Your species appears to control the healing process through mental determination. This should be impossible. Elena shook her head. We do not control it exactly, but we do not give up when injured. Giving up makes healing harder. Through the window, they could see Rodriguez working with the physical therapist, putting weight on his injured leg just one day after surgery. He was grimacing with pain, but pushing through the exercises. Dr. Vosichin made a sound like cracking glass. The patient Rodriguez is forcing his damaged limb to function despite obvious pain. In my species, such action would cause permanent damage. For humans, controlled movement helps healing, Elena explained. Rodriguez's bone will grow back stronger because he is using it carefully. Elena called Rodriguez over to talk to the alien doctors. He walked slowly but steadily, using crutches to support his weight. How are you feeling today, Tony? Elena asked. Rodriguez grinned despite obvious discomfort. Sore as hell, Doc, but getting better every hour. This leg is going to be good as new in a few months. Dr. Zethkari stared at Rodriguez with what might have been horror. You are in pain, yet you express optimism about recovery. How is this possible? Rodriguez looked confused by the question. Pain is just your body telling you something needs attention. It does not mean you are dying. Hell, some of my best training days hurt worse than this. The alien doctors exchanged glances that showed their growing distress. Dr. Nithara's tentacles tightened even more. You compare medical trauma to recreational training. This suggests a fundamental difference in how your species processes physical damage. I guess so, Rodriguez said. Pain is temporary, but getting better lasts forever. Elena watched the alien doctors carefully as Rodriguez returned to his physical therapy. She could see that they were struggling with concepts that were basic to human experience. Dr. Kevin Walsh joined the group, having just finished checking on Stewart in the burn unit. Elena, Amy is doing remarkably well. Her burns are already showing signs of early healing, and her spirits are excellent. Dr. Vosichin's crystal body began vibrating rapidly again. The burn patient is also recovering, ahead of expected timelines. How extensively burned was she? About 30% of her body surface, Dr. Walsh replied. Serious burns, but not life-threatening with proper treatment. 30%, Dr. Zethkari repeated, his dark form seeming to shrink. Such burns would require complete biological reconstruction in most species. Dr. Walsh looked puzzled. Complete reconstruction. Why? Human skin regenerates very effectively with proper wound care and grafting techniques. Elena could see that Dr. Zethkari was close to some kind of breakdown. His normally upright posture was failing, and he was leaning heavily against the wall. Dr. Zethkari, perhaps you should rest, Elena suggested. The alien physician tried to respond, but his voice failed completely. His legs gave out, and he collapsed to the floor of the observation area. His body was no longer glowing at all, and he appeared to be unconscious. Dr. Vosichin moved to help his colleague. but his own crystal form was now flickering so rapidly that he could barely coordinate his movements. The grinding sounds from his body grew louder and more distressed. Dr. Nithara tried to move toward the fallen Dr. Zethkari, but her knotted tentacles prevented any coordinated movement. The light patterns on her skin were flashing chaotically, and she seemed to be losing control of her biological functions. Elena immediately switched to emergency medical mode. "Katie, Bob, we have alien patients in distress. Get me the xenobiological medical protocols." Elena and her team had some basic training in treating alien physiologies, though they had never needed to use it before. She quickly assessed the 3 collapsed alien doctors. Dr. Zethkari appeared to be in some kind of psychological shock that was affecting his bioluminescent systems. Dr. Vosichen's crystal structure was becoming unstable, with small pieces breaking, often falling to the floor. Dr. Nithara's tentacles were so tightly knotted that her circulation seemed to be compromised. "What is happening to them?" Dr. Walsh asked. Elena was checking what vital signs she could understand on the alien patients. "I think they are having some kind of psychological breakdown from watching human patients recover so quickly." Collins appeared in the doorway, still moving slowly but under his own power. "Doc, are the alien doctors okay? They look pretty bad." Elena looked up from her examination of Dr. Zethkari. "Danny, you should be resting." Collins ignored her suggestion and moved closer to the alien patients. "They have been watching us pretty intensely. Maybe seeing people get hurt and bounce back so fast was too much for them." Dr. Walsh was trying to stabilize Dr. Vosichen's crystal structure using techniques they had learned for treating crystalline alien physiology. Their species probably evolved without experiencing the kind of trauma that humans consider routine. Elena was working on Dr. Nithara, trying to carefully untangle her tentacles without causing additional damage. Most galactic species have advanced medical technology that prevents them from experiencing pain and injury the way humans do. Rodriguez appeared at the door, moving on his crutches. "So they have never seen anyone get hurt bad and then get better." "That is probably exactly right," Elena replied. "To them, what we consider normal human toughness looks impossible." Collins sat down carefully near the unconscious Dr. Zethkari. "Poor guys. They came here to learn about medicine and got a lesson in being human instead." 3 days later, the alien doctors had recovered enough to sit up in their specially prepared treatment areas. Elena had worked with xenobiological specialists to create proper care environments for each species. Dr. Zethkari was slowly beginning to glow again, though much dimmer than before. Dr. Vosichen's crystal structure had stabilized, but he still made occasional grinding sounds. Dr. Nithara had finally managed to untangle most of her tentacles, though she moved very carefully. Elena entered their treatment area carrying a data pad with the medical reports from the past few days. Behind her came Collins, Rodriguez, and Stewart. All 3 human patients were mobile and recovering well. "Good morning, doctors," Elena said gently. "How are you feeling today?" Dr. Zethkari's voice was weak but clear. "We are recovering, Dr. Martinez, though we are not certain we understand what caused our condition." Collins stepped forward, moving easily despite his recent surgery. "I think you guys got overwhelmed watching us heal up. Maybe where you come from. Getting hurt is a lot worse than it is for humans." Dr. Vosichin made a soft chiming sound. "Your recovery rate is impossible according to our medical understanding. We have studied thousands of species, and none heal as rapidly or completely as humans." Stewart, despite her extensive burns that were already showing remarkable healing, smiled at the alien doctors. "We are not special or anything. This is just how humans work. We get hurt, we heal up, we keep going." Elena sat down near the alien physicians. "I think the problem is that your species have advanced beyond the need to deal with serious injuries. Your technology prevents trauma, or fixes it so completely that recovery is automatic." Dr. Nithara's tentacles moved in slow, careful patterns. "This is correct. For thousands of years, my people have used bioenergetic healing that repairs damage instantly. We have no experience with gradual recovery." Rodriguez, supporting himself on one crutch but putting weight on his injured leg, nodded. "So when you saw us getting banged up and then healing the slow way, It looked impossible. More than impossible, Dr. Zethkari said, his glow brightening slightly. It appeared that humans were performing biological miracles through determination, alone. Elena pulled up some charts on her datapad. Let me explain how human healing actually works. Our bodies have evolved over millions of years to repair damage. When we get injured, our immune system, circulatory system, and cellular regeneration all work together to fix the problem. Dr. Walsh joined the group carrying his own medical data. The key difference is that humans evolved as what we call persistence hunters. We had to be able to keep going even when injured because stopping meant dying. Collins sat down carefully, still protective of his healing surgical site. My grandfather used to say that humans are like old boots. The more you beat them up, the tougher they get. Dr. Vosichen's crystal form flickered with interest. Your species developed psychological resilience as part of physical healing. Exactly, Elena confirmed. Human medicine works because human patients want to get better and are willing to work for recovery. We do not just fix the injury, we support the patient's natural drive to heal. Stewart touched the healing burns on her face. When I got burned, it hurt worse than anything I had ever felt. But I knew Dr. Martinez could fix me up, and I knew I would get better if I followed her instructions. Dr. Nithara's light pattern shifted to show curiosity. You experienced severe trauma, yet maintained confidence in recovery. How? Stewart thought for a moment. Because I have seen other people get hurt and get better. My brother broke his leg when we were kids, and 6 months later he was playing sports again. My mom had cancer, and after treatment she was healthier than before. Humans bounce back. Elena nodded. That is the key. Humans grow up seeing injury and recovery as normal parts of life. We develop psychological tools to deal with trauma because we know recovery is possible. Dr. Walsh added, our medical training focuses not just on treating injuries but on supporting the patient's natural healing mechanisms. We work with the human body and spirit, not against them. Rodriguez demonstrated by doing some of the physical therapy exercises he had learned. See, my leg hurts when I do this, but I know the movement is making the bone grow back stronger. Pain is information, not a command to stop. Dr. Zethakari's glow became brighter as he began to understand. Your species treats pain as data rather than as system damage. Right, Collins said. Pain tells us something is wrong. But it does not mean we are broken. We can work through pain when we know it is helping us heal. Elena showed the alien doctors some before and after medical scans. Look at these images of Collins's surgical site. 3 days ago, there was significant tissue damage. Today, new tissue is already growing to repair the damage. Dr. Vosichen studied the scans carefully. The regeneration rate is remarkable, but now I understand it is normal for humans. Normal for humans who are properly treated and motivated to heal, Elena corrected. Our job as doctors is to create the best conditions for natural healing to occur. Stewart stood up and walked around the room, showing her mobility despite her recent burn injuries. And our job as patients is to follow instructions and work hard to get better. Dr. Nithara's tentacles moved in what Elena recognized as their species expression of amazement. You have created a medical system that combines primitive tools with advanced psychological understanding. Elena laughed. I never thought of it that way, but I suppose that is accurate. We use scalpels and sutures because they work, and we combine them with human determination and hope. Captain Morrison entered the treatment area. Doctors, I have received communication from the Galactic Medical Council. They want a full report on your observations here. Dr. Zethkari's glow steadied as he seemed to regain some of his strength. Captain, we will need time to prepare our report. What we have learned challenges fundamental assumptions about galactic medicine. Dr. Vosichen made harmonious chiming sounds for the first time in days. We came here expecting to study primitive medical techniques. Instead, we discovered that human medicine achieves superior results because it works with evolved human psychology. Elena felt a wave of pride in her profession and her species. Our techniques might seem basic, but they are perfected over thousands of years of treating human patients. Collins grinned. Plus, we are just too stubborn to stay broken. Rodriguez nodded, balancing easily on his healing leg. Humans do not give up. That is the secret to everything we do. Stewart added, we get knocked down, we get back up. Sometimes we get knocked down again, but we always get back up eventually. Dr. Nithara's tentacles formed complex patterns that Elena thought might represent deep thought. Your species has created medicine that treats not just physical damage, but the entire concept of recovery itself. Elena stood up and looked at her 3 human patients, all mobile and healing well just days after serious injuries. Human medicine works because it treats human beings. We understand that our patients are fighters, and we give them the support they need to win their battles against injury and illness. Dr. Zethkari's glow was now almost back to normal intensity. When we return to our worlds, we will carry knowledge that will transform galactic understanding of medical care. Elena smiled. Just remember that what works for humans might not work for everyone, but the principle applies. Understand your patients, work with their natural strengths, and never give up on recovery. Collins, Rodriguez, and Stewart stood together, 3 humans who had faced serious trauma and were already well on their way back to full health. They represented something the galaxy had never seen before, a species that treated healing as just another challenge to overcome.